Welcome back to the last session of the Northern Rural and Remote Health Conference. And thank you all for being here and for staying at the end, but more importantly for making the journey here. Whether you're from near or far, you came here and you spent your long weekend with us, and we spent it together, and it's just been wonderful. And I heard so many positive comments and ideas that were emerging from the morning sessions. So thanks everyone who presented and was flexible about when they presented, and for those of you who attended and showed that flexibility as well. It was a wonderful morning. And on the topic of flexibility, we have someone who is very flexible and gracious today to allow her plenary to move from the morning to the afternoon. And we're actually really excited about how this has worked out, because I think it will allow us to close in ways that will tie up a lot of the messages and things that we've been learning all week, or all weekend, I should say. So it gives me great pleasure to welcome up to the stage Julie Bull, who's the Research Methods Specialist for the Center for Addictions and Mental Health and a sessional professor at the University of Toronto, and, if she's not busy enough, a PhD student at the University of New Brunswick. Julie Bull is an award-winning Inuk researcher and educator from Happy Valley Goose Bay, and is a member of Nunavut, Labrador, with more than 15 years of experience in community-based research and education involving Indigenous communities. She is a Vanier Scholar and is active in both academic and grassroots research ethics initiatives, including the Committee for Education and Outreach with the Panel on Responsible Conduct of Research and the Nunavut Community Council Research Review Committee. Julie is a mentor in the Indigenous Women in Community Leadership at the Coady International Institute and an international council member of the Association of Polar Early Career Scientists. Julie, it's a pleasure to have you here, and thank you for this talk.
It's 17 degrees in Goose Bay today, so I didn't have a fan on me. Thank you all for coming. I'm glad to see that there's still a lot of people here at the end of the session. I know it's been a long weekend with lots of learning and lots of networking, so I'm glad to see so many people still here. As Ashley mentioned, I'm originally from Happy Valley Goose Bay, so it's very lovely to be on the stage in my hometown, to see lots of people coming from around the world, to talk about issues that are important to us here locally, but also to see what's happening all over the globe. So today I'm going to talk to you a little bit about, this intersection that happens with Indigenous and mainstream people coming together and understanding how we actually benefit Indigenous communities, how we can improve Indigenous health by ensuring that we are actually not only including Indigenous voices, but that we are being led by Indigenous people, that we're not assuming other ways of understanding, but rather taking from our communities and bringing them out. So the reason I have here about the doing the right thing is because, as I mentioned, a lot of my work is in research ethics, and we talk a lot about what that means, what it means to do the right thing for Indigenous people in research, in policy, in clinical delivery, and in program delivery. So, of course, at first, I would like to show you this lovely photograph that I took. This is from an iPhone, unfiltered, across the Churchill River on Saturday morning this weekend, and acknowledge the land that we're on, traditionally and still contemporarily, with the Innu and Inuit, who continue to be stewards of the land here. And I'm so grateful every time I come back, and even when I'm away, I see the pride in people who live in Labrador, and that we all come together to really help benefit our own communities. So I would like to also encourage all of you in the work that you do, in whichever territory you're working in, to not only acknowledge the land, but to have action based on that acknowledgement. So it's one thing for us to recognize whose land we're on, but then we actually have to think about what that means and what actions we can take in whatever our professions are in doing that work. So a little tiny bit more about me to kind of contextualize. I work in lots of different ways. Currently I work at a mental health and addictions hospital, the largest one in Canada. I also teach at universities. I work in community development. I do evaluation. I do research. I write. I am an activist. I do all kinds of things. And for me, this kind of holistic or interdisciplinary way of understanding is just natural. It's just the way I am. It's the way most people I know in Indigenous communities are. It's our perspective. It's not linear. It's not 1 to 2 to 3. It's a much more holistic perspective. And so in my doctoral studies, which is in interdisciplinary studies, I see a lot of other students really struggle because they come from very specific disciplines: psychology, kinesiology, social work. And though they think that they're thinking holistically, They're really not. They're still looking at it only from one discipline. People have a really hard time because that's how we're trained. We go to school for lots and lots of years as clinicians and other people, and we learn a very specific way of doing it. So it's often hard for us then to be able to negotiate that space with multiple ways of understanding. So there is no secret recipe. There is no formula. There is no way that I can just give you a checklist. And people always want that, especially when I'm giving talks on research ethics. They're like, but why isn't there just a checklist for me to go through and see if I've done all the things? There isn't that. So instead, and I'm very grateful that my mom is actually here in the audience today, she would always say to me, you will because you can. And so it doesn't matter what we come from, what our backgrounds are, what the challenges are. And I've heard that a lot today. And I want to acknowledge Shirley Flowers from the talk this morning. So powerful to speak from our own experiences and from what we've been through, and to understand that regardless of what those things are, we actually can still make really significant strides forward by acknowledging where we've come from and how it is that we can use that in moving forward. And so I found this article recently. It's about HIV prevention and young people being leaders. And the first part of their talk is, or their title is, when you follow your heart, you provide that path for others. And I've seen that in countless times this weekend in listening to people's session. People are so passionate about the work that they're doing in whichever sector, field, community, territory that they work in. And so when we do that, we open up that space for other people to follow their heart too. It's not always easy to do that, and so I encourage you that when you follow your heart, you still take your brain with you, so that we make sure, we're still being a kind of intelligent in how we're following our heart and doing that work. So a lot of us will know that we work at intersections, and most people understand an intersection of one or two things. But for me and for many of us working in Indigenous health, the intersection is far more complex. There are so many different roads coming together. Sometimes paths are above and under, and we don't even necessarily know where we start. And so I want to kind of frame this talk and for you to think about throughout the rest of the day. This is from a couple of my colleagues in Toronto, Dr. Shaw and Stewart, who say health is a political construct, not a biological or technical process. And so I think as we heard this weekend from many of the Indigenous leaders who have spoke to us, many of the Indigenous people who have given sessions, we know that there is more to health than the absence of disease. There is more to health than that biological and technical process. We know it's cultural, it's political, it's social, and it's a construct that we all work within. And for Indigenous people, we often get the brunt of that. We have a lot of health disparities and health outcomes that are far less great than those of our non-Indigenous counterparts. So for many of us who are both Indigenous and work in mainstream institutions, we find ourselves trying to balance between these two worlds. And if you don't know, if you're not an Indigenous person, you may be able to kind of conceptualize what that looks like, but you really don't know what it's like to walk a very fine line between those two worlds. And even though I've been doing yoga for 5 years, I'm still not very good at keeping my balance. So sometimes on that tightrope, it can be very challenging to make sense of those two different ways of understanding together. So when we're working in Indigenous context, we need to understand that people are coming to us with a different way of understanding, a different way of being, and a different way of knowing. And I think for all of us to remember is that not only is research relational, but everything we do is relational. We can't separate ourselves from the natural world, the physical world, the spiritual world, and the social world. It's not just our relationships with each other and with ourselves. It's with past and future generations. It's with our children and our ancestors. It's with everything and everyone. And so in research especially, and in clinical care, we focus so much on one very specific thing. We kind of lose sight of how that's connected to everything else. We do a really good job of artificially compartmentalizing everything, as if it has no connection to other things. And while we may know cognitively that that's not accurate, and that things are indeed connected, we don't practice that in our research. And of course, we can't look at all things. A research project has a very specific question, and you're looking at something very tangible. But in doing that, we have to recognize there is a huge interconnectedness for Indigenous people that are working with us. So we might not always see all of those connections and how everything is related, but that's how Indigenous people think, that's how we see the world, and we need to be able to include that in the work that we're doing with Indigenous communities. And so one of the ways that we can learn to do that is through this notion of two-eyed seeing. And this comes from a Mi'kmaq elder in Nova Scotia named Albert Marshall. I've had a great honor to learn from him for the last almost 12 years or so now. And so basically what this is to consider on the one side, and for any of us who have been to university or being trained in Western ways of understanding, it's a very competitive environment. It's based on individuals, it's egocentric, it's all about what I can do, it's curiosity driven, it's based on very theoretical and scientific ways of understanding. And those are all important. We need to know how to function in that kind of a world. But then on the other side, from Indigenous ways of understanding, that notion of individuality is no longer as relevant. Things are much more collaborative and cooperative. And it's based on more fundamental human principles of things that come from the sacred teachings, like love and humility, wisdom and truth. And I know I once got kind of told off after a talk because someone said, well, but there's love. You can't say that we don't love people in Western science. And I said, that's not what I'm saying, but I know that I never talked about love in my physics class or biology class or any other class. I do talk about those things in Indigenous studies and Indigenous health systems, and when we're talking about how Indigenous people operate. So it's then the bringing together of those two worldviews. It's not a competition. It's not to say that one is better or worse than the other one. It's that they're both complementary. And imagine what we can do when we take the best bits of both of those worlds. We can solve problems that we think are unsolvable. We can find answers and solutions to things that we never thought were possible when we actually start bridging those two together. So I want to bring you back just over 20 years, because this is not a new conversation in this country about how we work with Indigenous people. In the early 1990s, the Royal Commission on Aboriginal Peoples was developed, and then in 1996, they released a series of reports, all of which were based on this idea and this notion of principles of a renewed relationship. So for some people who may have just been getting into working with Indigenous people the last few years, you may think that it's a relatively new conversation, but it isn't. It's been ongoing for a very long time. And it was in that same year, in 1996, that we saw the last residential school in this country close. So this is not ancient history. I think none of you look young enough that you were not around in 1996. So I think we were all in the education system then, at some level, maybe young grades, maybe post-secondary, maybe already teaching and practicing in clinical care. But we had already been through that education system while residential schools were still ongoing. And so fast forward several years later, of course, I hope everybody here has heard of the Truth and Reconciliation Commission. And from that very difficult series of events that happened for years, talking to survivors of residential schools and to understand how we as a country of non-Indigenous and Indigenous people can move forward in that relationship. There's 94 calls to action, of which all Canadians will fall under. So even though some of them sound very specific to government, some of them sound very specific to institutions, there's things there for every single individual Canadian to do, both in your personal life and in your professional life, to actually be able to move forward meaningfully with Indigenous people. And so there are many sectors that they talk about in the Truth and Reconciliation Commission. For most people here, we focus, of course, on things like health and education, but we recognize that they're all connected. So we can't separate the child welfare and the language and missing and murdered Indigenous women and children. These are all connected. So back to that point earlier about it all being relational, the same is true here. So while we may look at health from a very linear lens in our work, we need to recognize that in order to address Indigenous health issues and challenges, we need to look at it in a much more holistic way. And so Justice Murray St. Clair was the chairperson of the TRC. I just put here, while Indigenous children were being mistreated in residential schools by being told that they were savages and heathens and pagans and inferior people, that same message was being delivered in the public school system in this country. So all of us, whether we were Indigenous or not, and no matter which schools we were in, we were being delivered this message. And so I believe this to be true. I'm the first person in my family to graduate high school, to go to university. I understand some of the challenges that exist in breaking barriers and in going through obstacles. And we see here that education got us into this mess, and I think education will get us out. But we actually have to work at doing that together in a collaborative way. And so while that's very Canadian-specific context, I want you to remember also the bigger picture, that we have the United Nations Declaration on the Rights of Indigenous People, which was adopted in 2007, which is now a decade ago. And at that time, it was rejected by 4 major players in the world: the United States, New Zealand, Australia, and Canada. It was then almost a decade later, so in May of 2016, Canada finally adopted the UN Declaration. And then unfortunately, it was only 6 weeks after that, in July of 2016, that we were told that it was not workable within the existing Canadian law. And so still now, a year later, we're seeing it's not been implemented and people are talking about it, but still it's not workable within our colonial structure of how the law has been created in this country. So until we actually learn how to do that, we're not able to really implement these international guidance. So locally here in Canada, that means we're seeing lots of things around problems with the National Inquiry to Missing and Murdered Indigenous Women, the child welfare, an ongoing issue that's happening in this country. More than, I think, twice now, maybe even 3 times, that the Human Rights Tribunal has told the federal government to stop discriminating against First Nations children, and yet still the federal government, instead of giving the same amount of money to Indigenous children, are using that money in litigation. We're using that money instead to fight Indigenous people rather than to give us the same thing that other Canadians have. We're not asking for more things than other Canadians have. We're asking for the same things that other Canadians have. And so I think we have a lot of work to do to help rebuild some of the relationships between Indigenous people and other people in Canada. Here locally, and I'm not going to get political, but it is something that's happening all over the country, and here locally we see natural resource development happening, and not always with the consent and ongoing collaboration of Indigenous people. And so I saw a quote on Twitter a little while ago that talked about how all of these things that have been happening on the kind of bigger scale would be a game changer for Indigenous people in this country. The Royal Commission in the 90s, the TRC, the Truth and Reconciliation in the early 2000s, and now the inquiry into missing and murdered Indigenous women. But are we actually seeing a change in how things are operating? It seems like we do a really good job of saying one thing and doing a different thing. So how is it that we can actually start doing the same thing we're saying? I encourage all of you, if you have not already, to review this report that was written by a Métis physician in Toronto named Janet Smiley, First Peoples Second-Class Treatment: The Role of Racism in the Health and Well-Being of Indigenous Peoples in Canada. So we've heard a lot this weekend about different determinants of health, some social, some cultural, some political, some in lots of other ways. Racism is one of the biggest ones. Why is it that Indigenous people are dying in emergency rooms and not getting treated? Why is it that Indigenous people are suffering at home with lots of medical issues without seeking help because of how they're treated when they try to access that service? So we always hear of this, you do the best you can until you know better, and then when you know better, we should be doing better. But what I see constantly is that people are starting to know better, but are still not doing any better. So how is it then? How can we start to build this space instead of us saying one thing and doing another? What I'd like to see is us somehow to start actually walking the talk. Words really don't mean a lot, right? So this is why when we keep hearing apologies from governments, from systems, from institutions, but then no action after that, it's really hard to believe that those apologies mean anything. When you think about it, I mean, many of you probably have children, grandchildren, when they're young and you know, you make a mistake, you hurt somebody, you do something you shouldn't do, we learn not only to say we're sorry, but to mean that we're sorry, and to do differently. If we say we're sorry, but continue to have the exact same actions, then it doesn't really seem like we're actually sorry. And so one of the things that tends to happen is that we do all of these designs from the system level, but yet the user experience is something quite different. So we may have invested tons of time, resources, money, energy into creating something that we think, either from a Southern perspective, from an institutional perspective, from a non-Indigenous perspective, yet for Indigenous people, it actually makes no sense to us. Why would you even make that pavement over there? We could just walk right here. So sometimes the easiest solution is actually right already with us. It's in our communities. People already know. We don't always have the resources to do it, but we often already have the answers. We don't need researchers coming in and asking questions that we already know the answers to. We need researchers interested in collaborating with us to learn how to solve problems that we can't do without other people's resources to help us along. So what excites me is that the grassroots voices are getting louder. When I started this work about 15 years ago, it seemed like so few people were actually talking about this, especially around the governance of research and how Indigenous people have been mobilizing to have control of what happens and have a say in what happens in our territories, not just with our people, but also on our lands. And so I want to kind of remind you that there's a fundamental difference in how Indigenous people see the world and how a lot of other people see the world. I showed this in my other workshops, so apologies for the repeats for those of you who are there. For a lot of us, and we learn this in systems and in institutions, that we are an individual in the center of this universe, and then all the rest of it is around us. The plants, the animals, the water, the air, the ice, the land. But for Indigenous people, and people who work and understand the world in a more collective way, we are just part of that. We are not in the center of that circle. We are part of that circle. And so some people really have a hard time understanding that distinction because for the most part, we're so used to being ego-driven, to be that individual and yet somehow not connected to all those other pieces. And so when we think about Indigenous people who have been displaced from land, and this still continues to today in 2017, people are being removed and relocated from their homes and traditional lands. Of course that affects people, not just individuals, but communities, when we no longer can feel that connection to the natural world and to the spiritual world that is part of who we are. Another issue that often happens is being stuck in this deficit-based model. I've recently worked with an epidemiologist on a health policy grant for CIHR, and when he sent me that proposal, in contextualizing why we were including Indigenous communities, there was a page and a half about all of the health disparities in Indigenous communities. And I read it and I kind of shook my head and I thought, but this is about health policy. This has nothing to do with these specific things. What's relevant here is governance and jurisdictional issues and who gets a say in what happens in our territories. And I was fortunate that this particular epidemiologist was very open to having that conversation. And he said to me, I'm so glad you told me because everything I've ever read contextualizes Indigenous health with that page and a half of disparities. Why is that? Why are we focusing only on what's wrong rather than what's right? Every single community has strengths and resilience, otherwise we wouldn't still be here. So if we focus on those things rather than those things that are wrong, we can actually start building solutions to some of those problems without only focusing on those things that are problematic. So I like to always look for the opportunity, wherever it is. In that case with the epidemiologist, a little conversation to encourage him to think about other ways of looking at Indigenous health and Indigenous health policy. So I encourage all of you, whatever your work is, of course there are challenges. This is not to say that everything is rainbows and lollipops. We have challenges to face, but focusing only on those things that are not working well will only encourage more of those things. You know, the old saying of what you focus on will become. So if we focus on the strengths rather than the deficits, we actually start seeing much more positive outcomes. So a mentor to me, Dr. Jeff Redding, who I'm sure many of you know who've been working in Indigenous health, he said this great thing: we want to be at the table, not just on the menu. And I think this is especially true in the last decade or so, because everywhere you go, there's about Indigenous people, whether it's health, education, justice. Yet so often there are no Indigenous people at that table having conversations. It continues to be all kinds of other people speaking on our behalf or thinking they may know what's best for us. So I want to give you a few examples of some of the work that we're doing in Toronto. We are based in Toronto. Please don't hold that against me. We do a lot of work in Northern Ontario and increasingly around much of the Canadian North. And so as we continue to grow in our small little department in CAMH, we hope that we will be able to start partnering and collaborating with Indigenous communities all over the country. So our work is based on these guiding directions. And these were built in collaboration with Indigenous communities in Ontario. Our entire team in Aboriginal engagement and outreach, we are all Indigenous people. Every single person on our team is from Indigenous communities. We all have lots of different backgrounds: social work, occupational therapy, research, psychology, psychiatry, you name it. We're all there and we're collaborating together. And we're directed by these understandings of supporting the capacity within our own institution, because of course we recognize that in a hospital with 4,000 employees, a lot of people have no understanding whatsoever about Indigenous people or Indigenous communities or how it is that we can work together. We're enhancing clinically and culturally responsive care. So we heard from other people throughout the weekend of different initiatives happening where we're investing money, we're doing this, but if we don't actually have people who can give that care in a culturally appropriate way, then we're not actually making any advancements in providing care to our communities. We always want to look and strive to build more and more collaborative partnerships with everybody around us. None of this happens in a bubble or in a silo. We all have a role to play in coming together to do that. And so I want to share, these are some photos of a few people on our team who are just out and about in the community. You can see us kind of everywhere. And I forget who it was now. One of the presentations this weekend talked about, it's not just showing up as the researcher to collect data. Sometimes you're doing dishes all weekend, or sometimes you're doing other things. You're just there. You're present in the community as a human being, not as a researcher, not as a physician, not as a psychiatrist, not as a whatever else you are, but as a human, because we're that first. And so I think it's important that whatever it is that you work in, that you remember to include kind of those human connections as well as those professional ones. There's lots of initiatives that we do internally within the hospital. This is some of the posters from this past June, National Aboriginal History Month, where we did a whole series of things. We did a powwow boot camp, which saw about 50 people come together and do a really intense workout with powwow dance. There was one man who thought, I've been seeing powwows forever, it looks so simple. And then like 5 minutes in, I was sweating to death and it's really hard and I love it. We had Métis jigging, we had Inuit drum dancing. We did some more of the technical stuff. I did a research talk. And we did full moon ceremony. We had sweat lodges. We do all those things together. And one of the things that I was really pleased to see happen, it's not just our little tiny team at CAMH that is invested and committed and dedicated to this work. It's also the senior leadership, and that needs to happen, right? We need to have those buy-ins from all the different levels within our organizations. And so my director, Dr. Rennie Linklater, who wrote an exceptional book called Decolonizing Trauma Work for folks who are interested in that side of things, she spoke with our vice president about what our action plan is at Canada's largest mental health and addiction hospital for actually developing this reconciliation between Indigenous and non-Indigenous people. So while lots of other institutions this year have been celebrating the Canada 150, we were challenging the Canada 150. Yes, Canada's, as we know it today, is 150, and we can celebrate those things, but we can't forget other parts of our history. And so it's very hopeful and meaningful to me to see institutions like this one actually having those conversations and talking about ways that we can move forward that includes Indigenous people as well. This is a photo from one of the events we hosted in June where we screened The Angry Inuk, which is probably one of my favorite films that I tell everybody about. And we were so fortunate to have Alethea join us by Skype at the end. She's the director of the film. She answered questions. We had some sealskin ribbons that was made here locally, actually in Labrador, and sent to us. So we took a selfie together for anybody who's been following like the selfie thing. And people were really excited to kind of see how this works in practice. People were I still see them now, 4 or 5 months later, very proud of their sealskin ribbons. And everybody wants them, and of course we didn't have enough for everybody to get them, but those who got them feel really proud that they learned something new they never knew before. People, there's lots of media and propaganda or whatever about the seal hunt, and people just had no idea. So having these simple things, this is not a lecture, this is not anything formal. It's a film, it's fun, it engages people in a way that they weren't able to do before. And so, of course, while we do have lots of fun, we also do some of the more serious things in clinical services and in acute care. We have a whole department that is of Aboriginal services. Not all of the clinicians are Indigenous people, but most are. And of course, the goal is for us to have everybody in Aboriginal services be Aboriginal people who can provide these service. You'll see here that the bottom picture illustrates the building of the Sweat Lodge at CAMH, the first hospital in the country, a major hospital like CAMH, to have these things on site. So no longer do we have to be partnering with different places or trying to find different services in different locations. When an Indigenous person comes to our hospital for care, they're given the options. And some people choose a psychiatrist over a traditional healer, and that's okay. We also can't make the assumption that all Indigenous people want to only be in the Sweat Lodge. Many do, but we also need to recognize there are multiple ways that people want to get treatment. So we give people that choice. And if you get not many things from my talk today, I hope that's one that you will get, that Indigenous people ought to always have the choice in how much they participate, in how engaged they are, in what it is that they contribute to your project. The consent and the choice is always the most important part. One of the things that I'm really hopeful for that's been starting recently, we've done telepsychiatry for a while. You can imagine there's some challenges with telepsychiatry. There's challenges with psychiatry in general, so you add a virtual component to that, and there are some other challenges. But the part that's really exciting to me is this newer initiative called ECHO. This originally started in New Mexico, and it was for physical health issues rather than mental health. And so basically what it is we have a team here you see in this picture that's based in Toronto. This team is very interdisciplinary: psychiatrists, psychologists, social workers, researchers, occupational therapists. And then the people who join us virtually are from all over the province who work in different settings. Some are community health nurses, some are traditional healers. We all have all kinds of really great and valuable things to contribute, but we can't always do it by ourselves. So we think here locally in Labrador, lots of the communities have one community health nurse. And while that person will know all kinds of things and do so much for our community, that person doesn't know everything. So if they were able to access this kind of a model where they can join in and then present a case that's difficult, they don't know what to do next, what are the next steps, you're then bringing together this community of practice in a virtual way, building that throughout the province. And I mean, my hope and my goal is that this is going to start to go across the country, because so many communities could see value in being able to access the expertise from other locations and to share our own expertise, because we have all kinds of that also right in our own communities. And then of course, Ontario is huge, and so we have this mobile research lab that goes on little road shows from time to time. There's 2 different size ones. We can even do focus groups in there, we can have interviews, we do some clinical care, we do all kinds of things in this mobile lab. And so it's taken a bit of time to help, encourage folks to not be so distrusting of our hospital, because I think like many institutions, hospitals and education specifically, Indigenous people, rightfully so, are resistant and have some distrust in what those systems are there to do. And so I think, it's a lot about who the people are in these positions, and I think that the people who have built the Aboriginal engagement and outreach at CAMH have done a really good job in helping people understand the benefit that we have because we listen. We don't impose what we think works in Toronto, because sometimes things will work in Toronto, but they will not work anywhere else. And that's also true of wherever we live. There are things that work here in Goose Bay that won't work in Cartwright or won't work in Nain. So why is it that we think we can come up with a solution in a city and then apply it all over the place? One of the most exciting things that's happening, and there's like not a great picture of it because it's not done yet, is this trauma-informed substance use screening and assessment tool for First Nations and Inuit. Because up to now, and I think we've heard this in a few of the other talks, there aren't very many, especially for adults. There are a few screening and assessment tools for Indigenous children that have been culturally adapted and or created, but there's very little in the way of these tools for assessment for adults. So for the last 2 years, people on our team have been traveling extensively throughout Ontario with 14 development sites to develop this screening and assessment tool. So right now we're at the testing phase. We've just applied for funding to do that next stage of actually testing now this tool that's been created in collaboration with First Nations and Inuit communities across Ontario. Another thing that we do, and this is something that many of you from around the country could actually get involved in, is the Mobile Training Teams Initiative. Again, this is kind of like a roadshow because we recognize we need to go where the people are. We heard that this morning when it came to men's health. Go where the men are. In this case, go where the Indigenous people are. Go where the people are seeking service. Go to where people are providing clinical care to Indigenous people who have never been trained how to do that. I mean, many of the major medical schools in this country do 1 hour of Indigenous health in their whole 4-year program. So we can't really blame those people who come out of that system and don't know what they're doing when they're going into Indigenous communities. They were never taught how to. So there are some programs that are starting to come up around the country that are helping people understand how they can do that. Our team specifically is within the Provincial Systems Support Program. I physically am in Toronto, but our program is around the whole province. And we in our little department have 18 people, all of whom, as I mentioned, are Indigenous, and we span the 7 of the 9 regions in Ontario. So those are just a few examples that I hope will give you some either ideas or encouragement of ways that you can do something in the work that you do. And so moving forward then, we need to not only be addressing this difference between equality and equity, which I think is really important that we do that. This image illustrates, on the one side, equality is sameness. So if we're all just given that one box, this poor little guy still can't see over the top. So it just seems fair, right, that we give the little guy 2 boxes. The tall guy doesn't need a box. He can already stand and see over the top. But this equity will only actually be realized when children from minority and other cultures that have disparities are meeting the same standards as other people. And I think one of the things that has resonated with me this weekend was when Natan Obed spoke, that it's hopeful that in the future we look back and we're no longer having this gaping hole in our moral standards. Why is it that collectively we seem to still do things differently for different people? So while it's important to address the equality and equity, for me, part of what I always do, and a call to action for every one of you in this room, is to rather challenge the systemic barriers that exist. We wouldn't need to have different or special accommodations if we actually address the root causes of why this is happening. And we can all do that. We've heard that from almost everybody who spoke this weekend about the systemic barriers that exist. Regardless of how advanced we may be in our communities, we're constantly struggling and fighting with these systems that are still imposing on us what they think is best. So often people think that they come against this stop sign that no matter which friggin' way they go, they can't make sense of it because everything just seems like the wrong way. And so I guess I definitely have times where I also feel that it's constantly up against challenge, whether it's with other communities, whether it's with systems, whether it's with whomever. I just encourage people to, while this is true, sometimes it feels like this, there is always a way to find our way through. And one of those ways is to be authentic. And this is a learning that I got from doing my master's degree 10 years ago, where I was actually talking about health policy, but what I learned was to be authentic. And I think being open to learning things that you're not actually seeking to learn is one of the most important bits. And so I did my research work here in Labrador, and lots of people talked to me when we're talking about the governance of research and how that applies in our communities, we need to base that on these very fundamental sacred teachings, back again to these notions of honesty, truth, humility. That's a hard one, isn't it, for academics and physicians and other people to be humble, to love, to be wise, and to have courage and respect in all of the work that we're doing. So I encourage you to do all the things, all of them. There is no wrong thing, anything, because this is what I've been noticing in lots of sectors that I work in. People are paralyzed by their fear of doing it wrong, that they do nothing. And that will never change. Nothing will change, right, if we don't do anything. So please, just do all the things. All of the ideas that you've had in your head this weekend, all the things you've heard from other people that they're doing in their territories, in their jurisdictions. It's not to say it's going to work exactly like that for you, but you can learn from what they've done and find ways that you can apply some of that in your practice and in your communities. And so the practice then, I mean, people sometimes are like, well, I don't know what that means. You got to keep doing it. You got to keep practicing it. I don't like that saying that practice makes perfect. There is no perfect, but practice makes better. That much I know. If you practice it, you will get better at doing those things. And so it's much bigger than just that consultation. We hear this all of the time when it comes to Indigenous people and communities. This duty to consult, the necessity of having a consultation process. And yes, that is true. That is necessary and it's important. But it's just one piece. We also need to have communication, real communication, dialogue, back and forth. Not people coming into our communities and talking at them and calling that a consultation. That's a lecture. That's different. The other thing is cooperation. We need to start being able to find those common grounds. They're always there. It might not always be obvious. It might be difficult sometimes and require a lot of patience and listening and understanding before we can find that place of cooperation, but there always is one. It's not a competition. We're not out here or out there to try to make this an us against them scenario. It's about finding those places of cooperation. And then finally, it's about consent. And of course this is true in research. Of course we need consent for participants. But this is true for anything involving Indigenous people. And again, I heard this so many times in the sessions that I was in this weekend about, you can't just come and do what you want without our permission. And it has to be ongoing. Consent is not just this one time. You can't have one conversation with one person who says, hey, good idea, and then you run with it. You have to keep having a conversation. Consent is ongoing. This is true for all people. We can't just impose our ways. So when we start to see all of those building blocks together, that's when that real collaboration happens. And so for me, collaboration is not about just gluing existing egos together. There's all kinds of teams that exist that have many people on them, but they're not really collaborating. They're all coming from their own backgrounds and disciplines. They don't actually listen to each other. They're quiet only insofar as they're trying to formulate what they will say next. They're not actually listening to what it is that you're saying. But if we actually come together and do that and listen from each other, new ideas that never even existed before will start coming to light. And so I guess I want to kind of clue up with a few things is that when we start changing the way we look at things, the things we look at change. And so we heard a few times this week about people having stereotypes about Indigenous people, or we're focusing on deficits, or we're doing all of those things. And so it's really hard for us to see that there's a different way. But imagine if we started focusing our attention in different spaces. If we start looking differently at the people around us. Like Jack Panashaway said yesterday, or the day before, the days all blend together now, that we as Indigenous people have to dispel our distrust against people who are coming to help us, and that other people have to dispel their disbelief about us. People have to change how they think about us. We're not savage people who don't know how to do things. We've been here for a very long time and have managed to not only function but thrive in an environment with all things thrown at us to get rid of us. In lots of ways, it's amazing that we are here today in the way that we are. This was never the intent. If you look back historically, there are lots of things that have happened to eradicate Indigenous people. Yet we are the fastest growing demographic in the country. So we're not going anywhere. We need to figure out how we will work together in moving forward. And to do that, we need to put people over process. Yes, process is important. I get it. I'm an academic. I know we need to do a lot of that stuff. That can't be the most important part. We need to remember people first. People over process. And people will help us with our process. That's the thing that people often forget, right? Is that if we actually collaborate and we have real, meaningful partnerships, that process part actually becomes a lot easier. And we do have to start challenging systems, but community collaborations will help us in moving forward. So we all then have a responsibility. Every single person in this room, everybody that you work with when you go back to your institutions, we all have a responsibility in helping move forward with Indigenous people. And if we change nothing, nothing will change. So there's some times where I'll give a talk like this, like everyone in the audience is so gung-ho, they're nodding their heads, they're writing stuff down, they're taking pictures of the slides. I'll see them a year later and ask what they've done differently, and the answer is nothing. So nothing will ever change then if we don't actually do something. So this is a great little cartoon that illustrates a very clear point, I think. When we ask who wants change, everybody puts up their hand. We recognize, right, like this is horrible, we don't want it to be this way. But then when you ask who wants to change, nobody. Nobody wants to do anything differently, right? We somehow expect it's just magically going to happen, that now we're going to resolve whatever the issue is without actually doing anything differently. So I want people to start reflecting on your own position. We all have them. I have a position of power as an educated person I've traveled around the world, I do lots of things, and I recognize that privilege. We all have to recognize that privilege. We all have it, all of us here, especially, who have traveled from all over the place. We have great positions in our institutions. We have power in that, and we need to use that power to actually contribute to meaningfully building those relationships with Indigenous people. I want to remind you of this important thing, that health is a political construct, not a biological or technical process. And so to sum up, first of all, we need to start shifting our perspectives. We can't just keep looking at things the way that we do. We need to challenge what we're being told. We need to challenge the different things around us and how that operates. We need to remember two-eyed seeing. And this is true for anybody that we're working with. We're all different. We all come from different backgrounds and understandings. And so to think that because you think a certain way is how everybody will is really not helpful to any of the people that we're working with, whether they're your participants or your patients or your clients or whoever they may be. We need to actually look at things from multiple perspectives. And we need to get outside of our comfort zone. Because, we say this to kids all the time, like, don't be shy, don't be nervous, get out, do it. Get outside your comfort zone. It's where the magic actually happens. And it is. You see that all the time. It's going to be challenging. It might be scary sometimes. It'll get messy. You won't always know the answer. Maybe you'll never know the answer. But you will at least start making progress and moving forward. And so I want to remind people that in whatever it is that you're doing as a clinician or a researcher or a policymaker, nothing about us without us. I can't attribute the quote to anybody anymore because about every Indigenous person that I talk to tells me this. Why is it that people are still doing these things without us? Why is it that they come into our community for a week or two during field season, they observe us, and then they go write about us? But they never actually engaged us or talked to us in that process. There are many ways of getting to the same thing. So we know that 5 plus 2 is 7, so is 3 plus 4, and so is 1 plus 6. None of them are wrong. I mean, except maybe there's new math that I'm a little bit confused about, but I think that these all still equal 7. And so people often say, well, I'm just one person in this big world, this big system. How do I make a change? If any of you have ever slept with a mosquito in the room with you, you know that there is no such thing as too small to make a change. And if you don't know what that's like, come back to Labrador in the summertime and you will know what that's like. So I encourage all of you, my call to action for you is to act as if what you do makes a difference, because it does. Even if you are not consciously thinking about the impact that you're having, it's still having one. Even if you don't get up in the morning and say, well, today the impact I will have is this. If you don't consciously start thinking about how you can do that positively, it may in fact be that you're producing harm, that you are actually contributing to some of those challenges that we still have. So as the day rounds up and you head back to your respective places this evening, I'd like you to ponder a couple of things. not only about my session today, but just in general, what this weekend has done for you. What are 3 things that you learned from today? What are 2 questions that you have, that you want to know more about, you want to investigate a bit more? And most importantly, what is one action that you will take after this weekend to contribute to rebuilding and to forging really powerful relationships between Indigenous and non-Indigenous people? So I'll leave you with the question, what are you doing to make things better? And here is again a beautiful sunrise of Labrador. Nakamik.
Thank you very much, Julie Wool. I think that was a really fitting closing plenary for the conference, because Julie really tied together a lot of what we've been hearing in a lot of the different sessions, and I think she leaves us with a really powerful message about what our own responsibility is in reflecting and in contributing to some of the things that I know folks have been hearing about. I mean, I wrote down a number of themes, I think, from the conference that Julie really reminded us about around social justice, around governance, around relationships and authenticity, and really about love. So I really appreciated your talk, Julie, and thank you.